Hi, I am Dr. Chinmayee, and today I'll be telling you about how many scans you need to do in a routine pregnancy. Now, when you're pregnant, you're very happy, you're ready to welcome another baby into your family, but you need to know how is the baby doing inside, and that's when you meet a fetal medicine doctor. In fetal medicine, we address problems that are related to the baby inside the mother. So we treat the baby inside the mother as a separate patient. So when you want to look at your baby, when is the first time that you can go and see your baby? The earliest scan that is done in pregnancy is done around 6 weeks, 6 to 7 weeks of pregnancy. That's roughly about 15 to 20 days after your pregnancy test has come positive or you've missed your period and you know that you are now definitely pregnant and we should see a baby inside the uterus. That is the first scan in pregnancy. The purpose of that is to establish the viability of the baby, to make sure that the baby is growing as much as it should for that stage of pregnancy, to see the heartbeat, to sometimes see whether there are more than one babies, because you may sometimes have twins or even triplets. So that's the scan which tells you how many babies are there, where are they, how is their heartbeat, and whether there is any other mass outside the uterus which can affect your pregnancy. The next important scan that happens in pregnancy is around the 3rd month. That is also called the NT scan or nuchal translucency. Nuchal is an adjective for the neck. Translucency is a translucent area. So that fluid behind the neck is checked on the nuchal translucency scan. This is a very important scan in which the structure of the baby can be checked from head to toe. You can see little parts forming. The whole baby looks like a miniature individual, and it's really amazing how you can see a little baby forming out of the small mass that you had seen in the viability scan. So the basic assessment of fetal structure, growth, even blood flow to the uterus, the shape of the size of the uterus, all that can be checked at the time of the NT scan. Then comes the 5th month scan, which is known as the TIFA or the targeted imaging for fetal anomalies, or simply the anomaly scan. The purpose of this scan is to rule out any congenital anomalies. Like babies are born normally, some babies are not so fortunate and they may have some or the other problems. There may be 2 to 3 out of 100 babies which may have some major birth defect, and this can be detected at the time of the 5th month scan or the anomaly scan. So looking at the baby structure in a lot more detail than what we saw in the 3rd month is purpose of the anomaly scan. At the same time, you can measure the cervix or the neck of the womb, which tells you whether you are at risk of having the baby beforehand. While you want to have your baby, you don't want to have it too soon. So if your cervix is very short, there are methods that can be implemented at this stage so that you can have your pregnancy lasting for the full 9 months, and that also can be checked in the 5th month scan. Again, blood flow to the uterus is important because some women may not have a good blood flow, because of which they can have high blood pressure or the baby may not grow very well inside, and that can be checked by the uterine artery Doppler study, which is again done in the 5th month of the pregnancy. So that's the 3rd important scan. Then in a routine pregnancy, in the 4th scan, that will be around the 8th month of pregnancy, roughly around 32 weeks of pregnancy, that is called a growth and Doppler scan, so that you look at the baby and make sure it's growing normally. Once you've ensured that the structure is normal, the other important thing is to check that the growth is fine. So if the baby is growing as expected for that stage of pregnancy, there's enough fluid around the baby, the blood flows in the baby are fine, then you are very satisfied and you may not need to do any more scans. But if things are not right, if the baby is not growing well, or if the mother develops some kind of high blood pressure or any other problems, you may need to have more frequent scans. Also, if you have twins or triplets, then situation is different. So if you have a complicated pregnancy or a high risk pregnancy, then you're given specific advice. But for most of us who don't have any high risk problems, who are normal and natural, you can enjoy your pregnancies and look at your baby at these distinct periods in pregnancy.